What is duty to warn and how does it affect confidentiality? Duty to warn is an important concept in mental health care that affects how confidentiality is handled. It refers to the legal and ethical responsibility of healthcare providers, especially mental health professionals, to act when a patient poses a serious and imminent threat of harm to themselves or others. This obligation is rooted in law and ethics, particularly highlighted by the landmark case Tarasoff v. Regents of the University of California. In this case, the court decided that mental health professionals must take reasonable steps to protect potential victims from harm, even if it means breaking the usual rules of patient confidentiality. Confidentiality is a cornerstone of health care, especially in trauma recovery and treatment for post-traumatic stress disorder. It ensures that what a client shares remains private and is not disclosed without their consent. This trust is vital for clients, particularly those dealing with PTSD, who often share sensitive and traumatic experiences. However, confidentiality is not absolute. If a provider believes that a client is at risk of harming themselves or someone else, they may need to break confidentiality to warn the potential victim or notify authorities. This is known as the duty to warn. The duty to warn directly impacts confidentiality by creating an exception to the privacy rule. If a client with PTSD indicates a clear intent or plan to harm themselves or others, the provider must assess the seriousness and immediacy of that threat. If the threat is credible and imminent, the provider is both ethically and legally required to act. This could involve contacting law enforcement, family members, or other appropriate parties to ensure safety. For individuals with PTSD, understanding the limits of confidentiality is crucial. Clients should be informed about these exceptions during the informed consent process at the beginning of therapy. This transparency helps build trust and ensures clients know their rights and the circumstances under which confidentiality might be breached. Providers must balance the need to protect privacy with the responsibility to prevent harm, always acting in the best interest of both the client and the community. In trauma-informed care, the duty to warn is approached with sensitivity to the client's experiences and vulnerabilities. Providers aim to minimize harm and maintain trust while fulfilling their legal and ethical responsibilities. This approach supports healing and recovery by creating a safe environment where clients feel understood and respected, even when difficult decisions about confidentiality must be made. In summary, duty to warn is a critical safeguard in mental health and trauma care, designed to protect individuals and the public from serious harm. It affects confidentiality by creating a necessary exception to privacy when safety is at stake. For clients with PTSD, clear communication about these limits fosters trust and supports the therapeutic relationship. Providers must always act according to established laws, professional guidelines, and the best interests of their clients.